So I'm going to start things off, and I'm hugely delighted to welcome our very first speaker to the stage. So Johanna Bogle, he's from the Deputy Director of Finance, and she's from Great Western Hospitals NHS Foundation Trust. So alongside that very busy job, Johanna is also the chair of the National FFF Health and Wellbeing Champions. And so I'll welcome Johanna to the stage now, and she's going to talk to us a little bit about the network, and there'll be opportunity again for you to ask any questions, particularly those who want to know how to get involved or know a little bit about what the work that Johanna's leading for us. So Johanna, shall I invite you to the stage?
Good morning. Thank you so much for inviting me here this morning to speak at your Value Maker conference. I'm delighted to see so many of you, and I'm really looking forward to speaking to as many of you as possible during the breaks. It's great also to see some health and wellbeing champions in the audience. And if any of you are interested in signing up, I've spotted there's some sheets downstairs that you can put your name on, or it's really easy via the NHS Finance website. The more health and wellbeing champions we have, the better I think we can integrate health and wellbeing into our finance departments. And I think the better we can serve our current staff, as well as attract new colleagues. These events are fantastic for feeling the energy of our networks and connecting ideas and best practice. And for me, they always result in hundreds of new ideas to take back to the team and improve things and the way that we do them. For those of you who don't know me, my name is Johanna Bogle, and I'm the Deputy Director of Finance at Great Western Hospitals in Swindon. I've been asked to present today due to my involvement with the Health and Wellbeing Forum for HFMA, where I'm the Senior Responsible Officer for the group. I got involved with it because I'm really passionate about health and wellbeing and about the importance of a health and wellbeing culture to a well-functioning team and feeling part of a team and not just doing a job. I think it's really important for all of us as finance members of staff and leaders to lead by example. So I want to show to my team and to all of the finance community that if I can take it really seriously, it's something that we all need to participate in. When I look back over my career to date, regardless of the difficulties or challenges in work or in the NHS finance at the time, the best memories I have are of organisations where the team was so strong that you felt almost part of a family, where I felt that people cared about me as a person and not just the work that I was producing. The culture we had in those organisations was one about spending time together as a team, not just as a finance function. In one organisation, we rounded everybody up for lunch every day. It was a little bit like herding cats at times, but we would all go to the canteen together, and there were all levels of seniority and experience there, from multiple teams functions. As a fairly junior member of staff at the time, the unofficial coaching, mentoring, networking, and learning that I absorbed from those daily half-hour breaks were priceless. I'm still in touch with some of that team about 15 years later, but it was such a simple solution, an investment of 30 minutes a day in really getting to know the team and the individuals who formed it. I'm going to share a little bit with you this morning about what being a health and wellbeing champion means, what we've been up to as a health and wellbeing network over the last year, what we're planning for the next 12 months, and how you can get involved. I've got a short section on ideas that I'd be delighted for you to pinch with pride, and I'm happy to take any questions as we go through or at the end. What is health and wellbeing? So we've been using the World Health Organization's definition, a state of complete physical, mental, and social well-being, not merely the absence of illness or infirmity. You can see that from the circles that in the middle there is the ultimate goal, and that's where you've got health and well-being, where you combine all of those three elements. The benefits of achieving physical, mental, and social contentment are numerous, not only for the individuals involved, but also the collective workforce teams. There was a report in 2009 by Borman which drew on survey results from 11,500 NHS staff, and they followed that up with consultation events with about 1,000 staff. This concluded that a happy workforce with good health and wellbeing provision led to better staff performance, improved patient satisfaction, stronger quality scores, better patient outcomes, higher levels of staff retention, lower levels of staff sickness, and a reduced perception of stress at work. The impact of this report is that NHS employers used it as a catalyst to create resources, with most, if not all, NHS organisations now offering health and wellbeing resources to their staff. It became a sequin measure for trusts in 2016 to improve their health and wellbeing scores, as identified through the National Staff Survey, which linked a direct financial impact to each organisation of improving health and wellbeing for their staff. At the time, it was worth about £450 million, and it was linked to improving the range of support across musculoskeletal, mental health, and physical activities. So, for example, fast-track access to physio, promoting exercise in groups, teams, or for individuals, having access to mindfulness applications, and promoting healthy travel to work, for example, with the Cycle to Work scheme. There was also the ability to improve the uptake of flu vaccinations by frontline healthcare workers so that staff were less likely to get sick, and to take action on the availability of food and drink sold on NHS premises to make them more healthy. NHS organisations were asked to focus on the organisational culture and to introduce health and wellbeing schemes to staff, such that the health and wellbeing agenda was led by a board director and senior clinician, and that managers were provided with training to assist them to manage their staff in a way that supported mental health, and patients and staff were able to access that healthy food and drink options. One NHS Finance supports the Health and Wellbeing Champions network with access to HFMA project staff, funding and speakers, and we really thank them for this. We currently have 166 Health and Wellbeing Champions nationally. This slide shows where they are currently located, with the North West presently leading the way for the number of champions who are already involved. If you see your region on here and want to bump your numbers up that league table, then please do spread the word and encourage your colleagues to sign up. Our aim is to have at least one health and wellbeing champion in every NHS organisation. That means that we're at nearly 50% coverage on average, so there's still a lot more work to do to achieve it. Our champions help to create opportunities for staff to access support and raise awareness of health and wellbeing issues. They aren't trained counsellors, but they are willing to listen to their colleagues if they need to talk, and to coach individuals to identify areas of their work or personal life that they could reflect on and potentially change for the better. One NHS Finance offers training for health and wellbeing champions so that you can learn a little bit more about health and wellbeing, spend a bit of time reflecting on your own health and wellbeing and how it can be positively or negatively influenced. You will also learn about reliable sources of information or support that you can then share with your colleagues. The training is quarterly and it takes about 4 hours over 2 sessions. It's online with breakout sessions, so you can practice some of the techniques in listening and coaching, as well as get to know some of your fellow health and wellbeing champions, and potentially create your own peer support network outside of your organisation. It also gives you the opportunity to access advice from experienced health and wellbeing coaches. If you would like to get involved, you just need to sign up via the One NHS Finance website, and it's not a huge time commitment. If you're already a value maker, it aligns really nicely with what you're already doing. Essentially, in the same way as value makers, health and wellbeing champions care about their colleagues and try to ensure that their staff feel supported at work. They aren't trained counsellors, but they are good at listening and providing reassurance and signposting people to sources of support. We also have a health and wellbeing teams channel where we share ideas for best practice, and good sources of information. So over the last year, HFMA and One NHS Finance have supported the Health and Wellbeing Champions group by listening to the ideas that we've shared as a group and putting on webinars, workshops, conferences and training. The last 12 months have included the items shown on this slide. We've done one wellbeing conference with the HFMA, 2 workshops on wellbeing in winter, 4 workshops on self-care through tough times, 4 workshops on dealing with change and uncertainty, and an online escape room, which was basically a Friday afternoon team event and was really good fun. We've supported staff through change, particularly where the CCGs and the CSUs were going through changes to become ICBs. So we put on 2 events for all staff on resilience and change, and 3 workshops supporting specifically those CCG colleagues. We've done 8 cohorts now of the Health and Wellbeing Champion training, and we've also done 2 mental health training workshops. We've had really good feedback. It seems that both we and our colleagues find these sorts of programs a useful and necessary part of ensuring our own health and well-being. None of it's related to finance, but it's so relevant to having a workforce that's mentally, physically and socially well, and therefore able to give their best to their roles. This slide shows what we've got planned already for late 2022 and early 2023. As well as the offers, I want you to take note of the numbers at the end, of those course titles. These are the numbers of people already booked onto those events, as at the end of October. So we've got Managing Stress and Resilience, 92 people for next week, 110 people for the middle of December on creating positive team dynamics. And in January, we've got a Health and Wellbeing Conference with 125 people already booked on, and we haven't even released the agenda yet. So there are people that are wanting this, and I guess what I'm asking for from you is more ideas for more events, and what do you want to see the Health and Wellbeing Champions getting on with to support you better? We also recognise the current cost of living crisis and intend to put together some resource packs around that. Then the Health and Wellbeing Champions can share them onwards in their teams and with their organisations. And we know the merger of Health Education England, NHS England and NHS Digital will be a change that our staff need supporting with. Building on the events offered to CCG colleagues earlier this year and late last year, ongoing through the change of moving towards ICBs, we intend to put on additional events aimed specifically at these staff. But we need your help. We need more ideas, more enthusiastic faces promoting the health and wellbeing agenda. And that's where I hope that as value makers, this cause is close to your heart and we can count on you to get involved. Whether it's an idea that you've got or something that you've already got in place in your organisation, please do share it with us. Or even better, sign up and help others in the region and nationally replicate what you've already done. Work in NHS finance will continue to be pressured moving into 23, 24 and beyond. So we need to make sure that we offer all the support that we can to our colleagues in helping them to manage their own health and well-being. I said at the beginning that one of the things I love most about the networking opportunities we have as NHS finance professionals is hearing about the great things that are going on in other organisations, as well as the sparks that are created by having a bunch of enthusiastic, creative, energetic people in one room talking together. It's almost like magic. This slide shows some of the things that have been done in organisations around the country. I hope that they spark ideas or generate conversations, or just give you the hints that you might need to do something similar in your own organisation in order to promote the health and wellbeing agenda. I'm really sorry if any of them have already been pinched from your value makers' ideas, but I'm really keen if anyone has any other ideas that you can add to the bank. I just wanted to pick out a few in case you can't see all of the words on there, because there's a lot of detail. So At a recent organisation I worked in, we had a really good social gang who would set up lots of virtual events. One of them we did was a virtual walk. So we organised a virtual walk from Gloucestershire all the way to the Oscars. And every week we updated where we were with fun facts about that location, pictures of where we were, and everybody logged all of their miles as a big team. So eventually we made it to the Oscars in time, and we had an awards ceremony where everybody was invited to dress up as if they were going to the Oscars, and we gave out awards, whether they were funny ones or a bit more serious. But it was a really lovely way of just recognising people, even though we were mainly virtual at the time. Another one we did was set up virtual coffee mornings. So this was in COVID, where people weren't having those coffee breaks and talking about different things. So instead, we organised almost a blind date networking event where people would meet with other colleagues within the whole of the system, the whole of the ICS, and they might not have ever met them before, but they had 5 minutes to just say hello. And what was really interesting was that we'd all forgotten how to have small talk. So we generated little guides of how to start a conversation with somebody you didn't know, just because it felt really nervous at the time. But having that was really, really lovely for seeing people that you might never have met before. And obviously now we're a bit less virtual, it's lovely to bump into them again. Newsletters are really lovely for just, again, highlighting positive things that are going on and really bringing together and celebrating what we're doing that's nice. Once we were back in the office, bring a plate lunches was lovely for just checking in with people and seeing that they were okay. They were all okay. As well as family days out, so organising walks and events with people bringing their whole family, not just being at work. So my final plug on how to get involved is to visit the One NHS Finance website under the networking area, and there's a link straight through to the Health and Wellbeing Champions. Do ask if your finance department has a Health and Wellbeing Champion, and please come and be part of our network. We're really positive, we're really supportive, and I think it aligns so nicely with what the value makers do. Thank you.
Thank you so much, Johanna, and not only for that presentation, but for your leadership on this programme, because I think the word that you used was necessary, and I completely agree with that. It's necessary for us to really support and think about health and wellbeing across the organisation. So some brilliant ideas, and you've come to the right place. You have genuinely come to the right place, because it's just what we're all about in terms of a network here in Value Makers. So for those that are already connected in, I'm sure that all resonates. For those of you who are not, I'm sure you're scribbling down how you get involved or how you can at least connect in with your health and wellbeing lead within your organisation. And just about that, so in my organisation, Gemma is my health and wellbeing lead, and she gets so much personally from being involved in the training and development support you get for becoming one. So there's a great development opportunity to be one. But then she brings it back into our organisation and shares it with her. My team did the virtual sort of the escape room as well, and loved it. Yeah, so those sorts of activities are just what we do need, actually, to keep our mental health and resilience through work. So great to hear all of that. Right, so I am now going to open it up for some questions for you. So for those that are here in the room, if you've got a question, raise your hand and somebody would appear next to you with a microphone to come and get those questions. But whilst we're just going to see Darryl there with his hand up ready and waiting. But I've got some that have come in as well from our virtual audience, Johanna. So if I just kick off with this first question. So what do you think the effect of the pandemic has been on your organisation's wellbeing strategy?
So that's a really good question. So we were talking about this actually before the conference started this morning. And it really feels like that flip to a virtual to a virtual working environment it's introduced some challenges. So I think it's made it a lot more obvious that we absolutely need to focus on that social aspect of those 3 circles. So clearly, if you're not in an office every day, you might not actually speak to anybody every day. And so we were very mindful in my older organisation about that, and therefore about setting up this social group and how we can try and overcome that element of not being face to face with people. So I think that was the main thing, is trying to make it into a positive, trying to make sure that we are having those virtual coffee mornings, trying to check in with staff on a daily basis, trying to actually talk to people every day, rather than just everybody being behind a screen typing away. Those Teams conversations that don't necessarily need to be output driven, but just checking in with people.
Yeah, thanks. And who would have thought, that our teams would be sort of dispersed in the way they have, and to feel like a team through that is really challenging, isn't it? So I think it has brought some positives in that we're focused on probably some of the more important things as well out of the pandemic. So great to hear that. I can see Daryl's got the mic in his hand. So Daryl, have you got a question for Johanna?
Yeah, I've got some questions and a few ideas as well.
Oh, that's what we want. This is a call to action, isn't it? So that, you'd say you're going to have some great ideas that come forward, I'm sure. Go for it, Daryl.
So part of the presentation, it focused a lot on the mental health wellbeing side of things, and that's what we've done within our organisation. What I'm getting from my staff now is they want information on the physical health. So that's sort of there's an idea for you. And what I was thinking is that we could have videos that anybody across the country could access. I have health and wellbeing meetings each month, and it would be great if we could show some of them and then have a discussion. So the other idea was around hidden disabilities. And we had a presentation at our last health and wellbeing meeting for somebody who has a hidden disability, and it was so powerful. So I can ask that individual if they're willing to do a webinar or something. So they're just my thoughts. A couple of the questions were, you provided information on how many people were coming to some of our events. Is there a maximum?
No. So most of them are virtual events, so clearly there's no maximum. In terms of the Health and Wellbeing Conference, I think we're at the moment doing that entirely virtually. Yeah. So again, anybody is welcome. Just picking up on some of your earlier points about the physical side of it, I forgot to mention there's a brilliant example in Gloucestershire. It's called the Health and Hustle, and it's basically a team that go around and they do the Couch to 5K on repeat. So they get through lots and lots of NHS staff. It's open to council staff as well. But it's such a lovely way of having a scheduled programme with an output at the end, and seeing people develop through that 6 to 8 weeks of getting to the end of a 5K is just brilliant.
I think some of our point is around like the physical health issues. So for example, we had somebody to come and talk about diabetes and the different types of diabetes and that impact. And that's some of the things that our staff are looking for, some of those sort of physical things, checking yourself for cancer and that sort of thing.
Yeah, that's really good ideas. Something came to me then. Oh, about what you were saying about EDI. So the hidden disabilities, I think that's a really good idea of getting people to understand more, and it links with lots of different One NHS Finance agendas, doesn't it? Bro, thank you.
Thanks for that, Daryl. And we had a conference in the Northwest not so long ago, and as part of that, where you have your the stands that are selling information from various different people, there was a stand there that was doing health checks and liver checks and all sorts of checks, but physical health checks. So just thinking about how and where we can introduce those sorts of things. That's a great idea, Daryl. So I've got another question that's just come in here from Slido. So some of these sessions that you've already run around supporting CCG staff, given the extent of the change that they're facing, are there any plans to be able to support those staff who are now in the ICB on an ongoing basis? Because they're still going through change and still very much feeling that. So what sort of things have they got that will be there to support them?
So you'll have seen from our previous 12 months that we had dealing with uncertainty and change as on our programme agenda anyway. So I wonder whether we either repeat those kinds of events or try and do something a bit more tailored to people who are going through a really specific change, because there'll still be lots of restructures that aren't quite complete. So yeah, that's another good one to take away.
Excellent. So I've got another question here. So when you shared the slide on the engagement statistics, now we all love a bit of competition, don't we? And to see the numbers there, I'm sure some folk in the room were saying, hang on a second, where's my region and why are my numbers up there? Have you got any insight into that? Because I think it was particularly this question focused on the Midlands and London had relatively low engagement numbers. So how can we really support and encourage them to get their numbers up and see the benefits of getting involved?
Yeah, again, we were talking about this before the conference this morning, and I think there's a bit of a cultural shift. So in the north, it feels like you've been doing this for quite a long time, and it's just become the norm, whereas particularly South, Midlands, Southwest London, I think it's a tide that's turning. I think generally we are getting more and more interest in it, and it's just getting that volume of people that are able to really make it embedded as part of our culture within NHS finance. But it's lovely to see how engaged they are, particularly in the north, like you say, at the top of that league table. And I guess every time we have a health and wellbeing group meeting, it's always trying to pillage their ideas. What can we do? What else can we do? Because sometimes it can feel a little bit lonely trying to constantly push. But once you've got the right number of people helping you, it then turns into an absolute joy, I'd say.
Yeah, and again, so I look in the room here and I see people like Karen. She's right in my line of sight. So Karen has done amazing work within London around raising the profile of value makers. So again, I think, this is a great audience to speak to, actually, because I'm sure you guys are all going to go away and talk to your organisation or talk to your networks about how I might be able to help you with some of that, Johanna. So okay, I have got more questions coming in. There's lots of questions coming in today. So, do you have any strategies to help those that aren't interested in taking part from those that perhaps might be more introverted within their organisation, so might not want to step forward and lead the whole thing for the trust, but actually this is really important to them. So how can we help everybody get involved without being the front face of it?
That's a really, really good question, because there's so much that we do naturally as a support services part of the NHS, where actually we don't need to be right in front of people. But some of those ideas around the newsletters, so just kind of creating content in the background, making things look really interesting and special. Also just coming up with ideas. So you don't need to be the person that's leading on the ideas, but just coming up with them, and then there'll be enough people, I would suggest, that are happy to push those forwards.
Okay. Another question that's come in. So there's a lot to take in. People saying they're really, really busy at the moment. If there was one really important message that you would like them to take from your presentation, what would that be?
So I think my one message would just be to check in with your teams, just to take one person and ask them how they are, and then ask them again, how are you really, just to check that they are all right, because sometimes we just automatically say, oh, I'm fine, thanks, how are you, and walk on. Whereas actually it's just that extra little bit of time, like I was saying, that 30-minute lunch break. Yes, it's 30 minutes away from your desk, but the ramifications of it are really, really important. It's the way that you make people feel. It's the things that you remember years later, and nothing to do with the work that you were doing, but how people made you feel. So the one thing I would take away is just check in with people for that little bit longer. Just leave the silence ready for them to say how they really are, and then try and listen, and if necessary, point them in the direction of support.
Thank you. So Sheila and I were talking just before, weren't we? And we're saying one of the sort of interesting things in the pandemic is that we've got to really start to focus on changing that culture back to talking to one another. We'll be emailing someone that's there and sending them a message on Teams, and they're there, so that, encouraging us to go and talk to one another and just check in and make sure everyone's all right. I think it's really important, because we sort of drift into that, and we've got to drift back out. So anybody else in the audience, please do raise your hand. Oh, we've got 2 questions there. I do apologise, I've not seen those. So there's a mic coming to approach you. I think it's Jack, isn't it?
It is, yes. Thank you very much. That was a really fascinating talk. Just listening to what you said there, not everybody wants to talk to somebody within their organisation. So is that something that we, because we are here in this room and those virtually watching, should be thinking about? Are we making sure that we're putting people in touch with charities, or as a network, is it an opportunity to maybe say you have an opportunity to speak to somebody outside of your network? Because sometimes there's that stigma still there, that if we see somebody in a corridor, because they might still be within our organisation or our department, that we see them and they think, oh, I've just spoken to them about something I didn't particularly want to talk to them about, etc. So just an idea, any from yourself?
Yeah, that's a really good point. Thank you. So one of the roles that we expect Health and Wellbeing Champions to play is that signposting. So every organisation will probably have various offers around that coaching and support that are not internal. So, for example, my organisation offers a helpline and access to mentoring if needed. So. And also, sorry, the word has slipped from my memory, but yeah, so that you can get into touch with people and even have counselling if you need to. But you're absolutely right, not everybody wants to talk. So what we're trying to do is just publicise the availability of that support, so that people don't even need to tell you that they're accessing it. But if they know it's there, then they can access it themselves.
Great, thank you. I think we've got another question just... One more question, I'm being told. So there's a question just at the back there, sorry, the gentleman 3 rows in. Thank you.
Hi, I'm Martin from Leeds Teaching. I was just wondering what engagement you have with staff networks, perhaps across the organisation. I know certainly I've been trying to encourage greater involvement with, let's say, the Men's Action and Awareness Network in the organisation with the value makers, just to kind of share those ideas, what's going on there. So I was just wondering how involved you are and what you'd recommend in relation to that.
So another really good point. I am not involved in any of those, so I think that's one that I need to take away and have a look at. But you're right, that everything links together so nicely, doesn't it? I know we have various networks in the organisation that we could definitely signpost to. So yeah, I'll take that as an action. Thank you.
Okay. So I know I've just been told that it's one more question, but I've just seen a really good one coming. So I'm just going to say it really quickly. I mean, I talk fast anyway. So within the finance workforce, the majority are female. Is there any thoughts about how we might support more in that space, whether that's working through menopause or returning to work after mat leave? Are there some specific things that we might be able to put on to cater for that huge cross-section of our finance workforce?
See, this is why I love coming to these events. They're just full of really, really good ideas. Yes, absolutely. So again, I know in our organisation, those kinds of talks are happening, but how do we engage them for the whole NHS finance profession and try and do things nationally or regionally that would, show that that's definitely a worthwhile one to do.
Excellent. So I hope you get a sense that, this network's up for this, definitely in terms of support, ideas. I'm sure there'll be a bunch more heading your way, Johanna. So I just want to say a huge, huge thank you for you to coming today and sharing your experiences and sharing everything about the network with us. So can we just thank Johanna in the usual fashion, please?
Thank you.
Thank you.